Okay, so we have an amazing panel lineup today. I'm going to go one by one and introduce everyone. First, I will reintroduce Dr. Kavin. He is board-certified neuroradiologist and educator focused on the skills that we need to stay sharp, grounded, and human as AI accelerates. Meenal Lele, joining us, is a Philly-based entrepreneur in the allergy space, and the founder of Hanimune Therapeutics. She has also built multiple companies and brings a builder's lens to solving real problems. Let's welcome Meenal. All right, I'll keep going from left to right. Dr. Scott Fournier. Oh, Robert Scott, sorry. Oh, Bob. Everyone call him Bob. Sorry about that. All right, he is the chair of radiology at St. Luke's University Health Network and is a leader in bringing AI into the clinical space. Everyone welcome Bob. Okay, so to my left, a very, very good friend over here. This is Edwin Desamour. He is also here tonight as the executive director of the Lighthouse. Go Lighthouse, by the way, if anyone's ever been there. Last year, I also did the STEM program, so I think that you will absolutely love it there. And the Philadelphia community leader focused on creating opportunities for youth. So everyone, please welcome Edwin. And last but not least, everyone knows Peter over there. He is the class clown of AI. I'm sorry. You're messing me up, Peter, okay? Somebody get this guy out of here. Last but not least, we have Dominic Chianese Jr. He is joining our panel and works in a substance abuse and mental health and is also here to bring the lens of presence and real human connection. So everyone please welcome Dominic.
I like doctor though, that sounded great.
I mean, we got Bob, we got doctor, we got clowns. We're having a great time today, guys. And if you guys don't know who I am Talia. I'm one of the executive directors of Philly iConnect. So happy that you guys are all here today to be with us. And I'm going to pass this over to Dr. Kavin.
So specialty about Talia is she rides horses. Yeah.
Our next event will be with horses.
Yeah. So, but thank you for that introduction. And so glad to see you all. You know, when Kristen reached out to me and said, we want you to bring the human element to this. And I thought, okay, so we can talk about the human qualities, which we did. But I said, what better way than to actually bring you individuals who are succeeding by using those human qualities. And so each of these panelists are unique in their own world, and they're leveraging a particular quality which makes them, each of them, very, very special. And so we're going to start off with Dominic. And Dom, you know, we talked about presence, and I talked about developing presence. But Dom has leveraged this tremendously in his work, and he brings so much value out there. And I want him to talk about how connecting with people and being real with people is so important in this day and age. So, Dom.
Thank you, Dr. K. I appreciate you. Hi, everybody. I got to be honest with you. I can only think about trying 1,000-day Gouda. That's all I want right now. I'm done. I'm just like, I'm completely obsessed about it. I just thought that was a great analogy. First of all, the guy at Trader Joe's saw him coming. He's like, oh, this guy's not buying cubed mild cheddar. We're going to give him the good stuff, you know? But that's a perfect example of that experience, We have a saying, I work in recovery from substance use, and obviously the co-occurring mental disorders that come along with it. It's always, the substances are always a symptom of a deeper issue, right? He says after going out to smoke a cigarette, like, I'm hopelessly addicted, right? But I'm in recovery. My girl up there, she's like, yeah, I saw you out there. We have a saying in recovery, connection is stronger than addiction. This is so important. People caught in addiction are so alone, they feel so alone. So the advantages of being human, in the human condition, is those magic words, me too. Right? So you could have the bot say, I understand, in its soothing voice, right? But nobody looks at me and like when I say, yeah, me too, they go, yeah, I believe you. You know what I mean? Nobody looks at me and is like, you really? No, we could tell, right? So we know that dark loneliness, and we know how to reach that person, and it does go beyond the statistics or the data, right? Or the research. When you talk about that Gouda, you know, I could ask ChatGPT, hey, what's 1,000-day Gouda? And they'll give me the history of the whole family in Amsterdam, right? Like, and they'll give me the exact chemical constituents and the full makeup and how it's prepared and all that. But eating it, that's the experience, right? We won't really know. So I believe that element of our humanity is irreplaceable. And you know, you talked about the advancements in technology, and it's moving rapidly. But until it becomes sentient, I'm not going to really trust it. And even then, right, might happen soon. Even then, how do we define whether it has consciousness, right? And even as a person who's in recovery themselves, honestly, my history with substances started as actually advancing my consciousness to a degree, right? We kind of like, you know, there's something to that. But I still couldn't define it. So let me put it this way. AI doesn't have an imagination. That's the difference. So if you're suffering and you're stuck, and I ask you to imagine better for yourself, and I'm that vision of hope, somebody who's been there and has found a way out, that's empirical evidence. That imagination, that maybe, just maybe, I can get better. If you could do it, I could do it. But we need that, right? Now, it doesn't mean that the data or the plans, right? But there's a physical thing. And the other thing it doesn't have is it can't hug you, right? Can't give you a hug. We do that in recovery. We hug each other because we know that we may not see you again. And we know that, right? And also, like, you know, you're going to want somebody with a little bit of experience. You know, if I'm having, you know, an issue with, let's say, a spot in an x-ray, I'm going to go to you guys, right? You're not going to come to me for, like, I don't know, advice on hair products. You know, you're just... You're going to want to believe that the person has some experience. Like, if I told you, oh, you know, I understand what it's like to be pregnant. No, I don't, right? The machine can't have that. We can. So the main thing about this is presence, and it has a science to it. We have a biofield, right? We know when somebody walks into a room. By the way, I'm doing this and this every time I walk into a room from now on. You know, there are certain, and you bring up actors. My father's an actor. He's been an actor his whole life. The guy can't help but captivate a room when he walks in. He can't help it. It's ingrained. But a lot of people are so insecure they don't even realize their presence, right? Until you see him on screen. Because anybody can read a line from a script, right? But you walk out on stage and you're already distracted, right? So it's brilliant to have the formula. It's brilliant to have the information that you gave us today. Really, the wow was really there. But it was you who bought it. I could have read that in a book. I could have heard it from, you know, a voice. But I believe you. And I just got to say that I'm completely honored to be on this panel with these esteemed individuals. Like, I'm like, hey, Grok, what's the symptoms for imposter syndrome? You know what I mean? Like, completely insecure in my mind. But you guys couldn't tell. You know? You believe me. You believe me. It's like, I believe you. I believe you were a crackhead and you ain't no more. You know what I mean? Like, and nobody judges that. Nobody judges that. Or maybe you do. But that's the human element right there. Right? We get better. Yeah. Thanks.
Awesome. One of the things we talked about was being meaningfully driven. You know, one of the things we're seeing in corporate and across many fields is people are disengaged. They're not engaged because there's nothing that's really driving them at their work. And I want to talk to Meenal next because, you know, very few people, you know, a lot of times people think of some issues that come up and you complain about it, but very few people actually look at a situation and say, oh, I'm going to solve this. I'm going to create a solution for this and create actually a company out of that solution. And here's an individual who's done that, who's followed that drive and has taken a need that arose and actually created a solution and a company out of it. And I'll have Meenal explain more. So please help me welcome Meenal.
Hi. So we were all told, so I'm the founder of Hanimune Therapeutics. We're a company that works in the food allergy space. And, you know, the short version of the story is 11 years ago, my son developed a whole bunch of food allergies. There's no history of this in our family. There's no, you know, there's a checklist of things. They just released a meta-analysis of 190 studies looking for the risk factors, and he has none of them. And so, you know, we were really blindsided, and I was very frustrated by the state of the science. And one of the things that, prior to doing this, however, I had been on the founding team of 2 different companies, both of which eventually exited. And you see a lot, but one of the things that you really learn is that there's a massive chasm between the science that we create as a society and then what we do with it. And I think the drive of, so when my son developed these allergies, my younger son was, I was already pregnant, and one of the first thoughts I had was, wow, this is incredible that we now know that food allergy is actually a preventable disease. And what we're going to do is turn this into a massive health disparity. Because I guarantee you that somebody's going to create a product, it's going to be only affordable to the richest Americans, and we're not going to be able to do anything about this. And this was you know, I called it. And that was immediately, like 3 months later, a company came out. They were charging like $200 a month for something that would help parents, and it would do what they said. But the real problem we had to solve was, how do we get this in the hands of every American? How do we make sure that this is something, and this is actually a real problem because our system is just fundamentally not set up to do this. And so I'm gonna go down a little bit of a rabbit hole here, but I won't take too long, I promise, which is, one of the first things we did with our company, the original brand is called Little Mix-Ins, is, you know, from the beginning, the goal of the company was that this has to be a product that is eventually able to be covered under insurance. Because if it's not covered insurance, if we don't give people preventive medicine for free, they don't do it. Like, how many of you would get a flu shot every year? I get it because it's free at CVS. If they told me it was $15, I would definitely not get it. I would walk out with my Band-Aids and be happy with myself. And so we just don't do things. We don't solve tomorrow problems, right? And there's a huge, how many of you knew that 60% of Americans or 60% of children in the United States are born under a Medicaid or CHIP? Right? And so this is a thing, most of us live in a bubble. But I happen to know that from my prior work. It's like 40 to 60%, depending on the state. And that's a huge population. If we want something to end, we can't make it. So but the way you prevent food allergy is fundamentally by giving babies these foods in infancy. And our insurance system refuses to cover foods. You literally have to pass laws to get insurers to cover a thing that they fully admit will cost them at worst 1 penny a person, will likely save them millions of dollars. They agree has sound medical science behind it, and they will fight it tooth and nail. And we finally got a law passed 2 years ago in Delaware, which went into effect this year. And so now food allergy prevention is free to all babies in the state of Delaware, which is a tiny state, but it's a step. Thanks. And I bring this all back to what you were saying because this kind of the focus of this is, one, you have to have a reason for doing this, right? It's a struggle, it's Sisyphusian. You have to have a reason that you believe that you know, something you feel like you're going to change the world and for the better. But the second thing to kind of tie it back to this whole question of AI is one of the things that this requires is the ability to do something that couldn't be learned from a model, right? Because if you ask the models, it would say all of this is not possible. But it is possible because if you go and you try hard enough and you meet with enough people, you find the legislator who cares. If you look them in the eye, and it takes years, it took 5 years to convince people that we weren't just making this up, that we weren't trying to pull one over on anyone, but building that trust is not something a model can do. And it takes a human-to-human interaction. It takes finding the people that have the stories and the history and bringing all that together to slowly convince humans to change, because we all tend to we tend to do what's easiest, which is do nothing. But anyway, so that's, I think to answer your, to the point is 2 points there is like, be focused on something that you actually care about, that you want to get out of bed. But I think that's a really hard thing for AI to do in the future. And the thing that humans will always have is because we actually care about something, right? There is a reason we get out of bed. AI doesn't need a reason to get out of bed because it doesn't have a bed. And so it can do anything, but then without that ability to differentiate, where should I put my energy? You can never put enough energy behind what you need to.
Thank you. So we develop presence, we develop meaning, and a meaningful drive. Thank you for sharing that. And then, we evolve from that to not just being independent, but being interdependent, which I think is such a key element. And, very few people actually admire their bosses, but I'm one of them because I get to spend time with this guy. And, Bob is such a powerful force in our organization, just from who he is. But more importantly, he's understood this term interdependence. And not only in creating a culture of trust in our hospital system, but trust with technology. We are implementing a lot of AI tools, as he will talk about, but we never felt threatened when all those AI tools were coming because of the way he's implemented them. So please help me welcome Bob.
Thank you. Thank you for those kind words. Again, you've heard him speak. You know what he's like. Try this on a daily basis. I call it, he's my daily dose of a Valium I get to take every day. My mission in life is to preserve his career. Again, he talks about preserving life, preserving yourself. I'm here to preserve careers. He kind of alluded to this problem up front. There is a massive, and I'm saying a massive shortage of radiologists in this country. Crisis is here, and if not, it's looming. Not just in radiology, but across the spectrum of all healthcare. We're short physicians, we're short nurses, we're short medical assistants. We're just missing all these key people that are going to keep baby boomers alive, and I am one of them. So my goal is to preserve him. With that in mind, you implement AI that'll make his career longer, to take the cognitive load of a radiologist down a notch or two. Use case. We've implemented a product. Let me back up to what radiologists do for those who don't know what we do all day. We sit in dark rooms, we read tens of thousands, if not hundreds of thousands of images every single day. He reads a CTA, which is a coronary artery CTA, looks at your head, neck, and vessels. There are 3,600 images per data set. and you probably read 20 to 30 a day. Do the math. It's exhausting. So we brought a product in that literally listens to us describe what we see. And this is what we do. We sit in this dark room, we have that speck in the left upper quadrant, or with this little dot in the right lower quadrant. There's a pixel that is off, we pick up. That's what we were trained to do. And as we talk, we then have to then synthesize all this into a short little paragraph called our impression. Again, hoping we don't forget something. In a very complex case, you will. I'm an oncology imager. I use my PET tools, and my PET scans are really what I was trained to read. They are tens of thousands of images. And by the time you start and you finish, it's 20 minutes. Will I forget something from the beginning to the end? Absolutely. A phone call interrupts what you're thinking. May lose track of your distraction. So we implemented this product that literally listens to us. It learned on 3,000, I think 3,500 of your prior reports and started to speak like Kavin. It synthesizes his reports just the way he likes them, in the order he likes them. So when you go to bed at night, you don't wake up at 2 in the morning going, did I put that nodule in or did I not? That's real. I literally keep a pen and pad by my bed to do just that. That's gone. We took that off the table by implementing this one module. And again, and the intent is to make us more efficient, when it did, but also to drop that cognitive load, because we worry. Because when we miss some things, people die. And we all keep that in our foreheads. It's challenging. Some of the other things we're really focusing on St. Luke's is bringing health equity across our continuum. We cover 80 square miles of territory. How do you have an ultrasound tech who's highly skilled across all 80 square miles? It's difficult. There is now a product out there, we're working with our partners in GE, that tells our technologists how to scan. It changes our gain, it changes our depth, it changes our focal zones. It does everything a good tech does. Not a great tech, but a good tech does, so we don't miss anything. That gives us health equity across 80 square miles. That is a tremendous use case, and we're starting to implement that now. Again, very wonderful technology coming. I'll actually tell you what the body part is too. It's really getting that good. They're actually using this in battlefields in Ukraine right now, helping soldiers literally put a probe on, is this patient's aortic injury or not? And sends those images across so we can see them. So I'm sure this is being deployed in Israel. I'm sure it's being deployed in the Middle East. The technology was here. The Gates Foundation funded it. They gave us $12 million to build it. It's here today and working. So tremendous use case to preserve people of both his talent and his caliber, but anyone who's kind of across our continuum and across our planet. So thank you.
Thank you, Bob. As we progress, we talked about individual success, independence to interdependence. But ultimately, as I mentioned, that we learn to chase a larger cause, which lives beyond us, a mission that lives beyond yourself, which is ultimately, people do not follow companies, people follow causes, right? And when you realize that, then it gives you much more meaning into what you do. And Edwin here, he has followed a much larger cause than maybe any of us ever will. And, he leads one of the largest nonprofits. But his story of how he evolved into this is absolutely fascinating. He's taken a situation which would knock out most people and actually turned it into an advantage and has given it back to the community in such a powerful way that, it is so inspiring to me and it will be inspiring to you. So Edwin, you're next.
Well, first of all, thank you. It's an honor to be on the panel. I started to figure out that I was about to go last after hearing all these phenomenal speakers. So I started being in the moment, monitor my breathing. I said, okay, I'm last, and I needed one more hug from Talia. I was like, I'm stressed. I took advantage of that earlier. So, but anyway, I just reintroduced myself. Thank you again. I'm a little nervous, and the reason I'm nervous is because I'm human, right? And at the end of the day, it's moments like this that I want to be able to represent my community and make sure that seeds are planted so folks could remember and know that people in my community are human. Because sometimes people in my community, where I come from, which I will speak on, we become just data and stats. There's no one breathing behind the data and stats. So I'm from North Philadelphia. I'm from an area called the Goodlands. I love those facial expressions when I do that. Anywhere I speak across the country, Philadelphia, and around the world, and I mention the Goodlands, everybody's like, where is that? But if I say the Badlands, folks are aware of that. And I don't believe that's fair to the good people that live in my community. So I always give that example. You know, can you imagine driving in your car, the GPS is on, and you're just trying to make it to your destination, and now your GPS says, you have now entered the Badlands. Many of you are going to be like, hold on, reroute. Reroute. You can easily push that button to reroute. But there are many people that can't push reroute because they live there, and those are good people. And they get labeled with that, and it's not fair to them. So I always try to work with folks in my community to say, wherever you step is good land because you're good, and it's about that energy. So wherever I go to represent my community, my organization, I always like to say, I am from the Goodlands. You know, many times I see people, their Instagram picture, and you put your location, it actually says Badlands, right? Whatever is generating that is not taking people's feelings into consideration. It's what they put into that. So I'm the executive director of one of the oldest nonprofits in Philadelphia, the Lighthouse 1893. So that's a shout out to my deputy director, Jillian, upstairs. When I stepped into the Lighthouse 4.5 years ago, Victor Tabak, who's now here, him and his uncle Brad, that's on the board, they approached me about taking this position, and I turned it down about 3 times. The third time I did it with the F-bomb. I wanted nothing to do with it, but I'm from that community. But after some while, I said, you know what, they see something in me, right? Something that AI couldn't see, something that data couldn't see, but they saw something in me. And not only that, they said, we're going to bring a crew behind you to back you. We're not going to leave you by yourself. So this is where I met Peter, Archie. You know, the list goes on, you know, and a great team. And I want to say something about just being human and energy. Anyone I've met so far through Victor and Peter, I feel comfortable when I walk into a room. It's just that energy and just feeling that. So that's very important, some things that we can't capture. Stepping into the Lighthouse role 4.5 years ago, one of our locations is a 15-acre field. Trash, it was dark, gloomy, no one attending. We probably had about 8 families, allegedly, on the books that are supposed to be attending this program. And 15 acres. Okay, I took this job, what I'm gonna do with this? So I decided to walk across the field, and there's a gate, there's a fence across this 15 acres, and on the other side, there's a cemetery. When I look over the cemetery, it's clean, the grass is green, people are together, and I'm saying, wait a minute, the birds are chirping. The cemetery has more life than this field. How is that? This is supposed to be recreation, a place where families are supposed to gather. So I took the challenge. I'm very competitive, right? Let's bring back what it's like to be human again and alive. So started working hard, getting a team together, getting rid of people who did not believe in being a human, who were disconnected. Sometimes you got to disconnect those people. I remember interviewing Jillian. He came with this fancy resume. I did not care about the resume. What I cared about was what was in his heart. And I asked him a few questions about what would he do if he saw something illegal? What would he do if he saw the organization leaving from his mission? And he answered that question. He gave me an example. I said, you're hired. You know, I didn't check if he could read or write, but but he's awesome. 4 years later, I just want to say we have over 14,000 families registered to the Lighthouse. Thank you. We have events where anywhere from we're getting ready for 800 people to attend, 4,000, 5,000 will show up. We have had 9,000 people on this field. We have a barn where people are getting married now. We're not sitting around for a funeral. Folks are having a sweet 16, a baby shower, award ceremonies. Grace the Sky is coming out, a STEM program where they're meeting human beings up front. They're bringing humanity to our children because they count, they matter. So data, stats, that's important. That's something AI can handle. But there are certain things that AI or data or stats cannot capture, and that is someone's soul smiling. People communicating with each other, which is very important. It's about being present. So I do look forward to some of the AI technology. I speak to Jillian about this because it could take a load off of us so we could be human beings again and get out there and do the work, because a lot of times when you're in the nonprofit world, it's hard to deal and speak to people because you're bombarded with paperwork. You're bombarded with trying to get this data together. So we look forward to that so we could really connect and be human all again. So backtracking a little bit on my life, born and raised down here. By the age of 16, I found myself arrested, charged with first-degree murder, facing life and death penalty. When you were allowed to get the death penalty at 16, I was found guilty of third degree. I was sentenced to 7 years, served 8.5 years in prison. So many people, if I give that story in a different context, not saying it's me, people will count me out. And I usually go out and speak. I said, what happens to that young man after he grew up in prison? What happens to him? What are his chances? And according to stats and according to data, I had no chance of making it. But no one ever once spoke about what would make me survive and make it was human contact. Human beings believing in me, saying, I'm glad you're here. I'm glad you're home. I believe in you. And I'm here to support you. So I've been home now 27 years. To the point where so much support that I didn't, this is my matter of fact, today I'm coming public with this. Last year, I was pardoned by the governor. I sat with this all year because I still couldn't believe it was real that I got pardoned, because I carried this on my back for many years. People would use it against me. And when people used it against me, it was the human beings like Peter, Victor, and so many folks that came to protect me and say, no, he deserves to be here. And allow me to do that work. And that work where the governor recognized that. And now I'm pardoned, no one can use that against me. So thank you. Thank you. So I'm gonna wrap it up, but I just wanna say I've been able, from a kid from North Philadelphia, experiencing the many things that I've gone through and still keep pushing. I have traveled this world from Europe to Latin America to Asia. And who would have thought that a couple of days ago, I was hanging out with Dr. Kavin at a Hindu temple, walking around. It's possible, but it's about staying connected. Thank you.
Such an inspiring story. You know, if you guys ever get a chance to check out their facility and what they've built, and Lighthouse has transformed that area from what it used to be. I would urge you to check out their website, because it's phenomenal what they have done in that area. And I'm going to hand it over to Talia to do the wrap-up questions. Go ahead.
I don't think I can go after Edwin. Okay, so before I go, I'm going to do Okay. Do you feel my power now? So I don't know if many of you guys know, I'm a vendor for Microsoft. I'm heavily much involved in data and AI and things like that. So hearing each one of your stories makes me kind of rethink how much of a advocate I am for pushing everyone to use AI. I know that AI for me is a tool, but sometimes, and I'm going to be honest, I forget about the humanity piece of it because I'm so ingrained in it every day, right? So from what I've heard from everyone's stories today, like what can you not replace AI? Like what can you not replace like with human, right? With AI, what I've heard is imagination. AI does not have imagination. AI does not have people caring or trust, right? And obviously, but everything that you said can't replace anything, right? But people, to me, I see all of your strengths. They all came through today, and you all have amazing stories. So for me, the question that I have is, how do you think that the future, can you leverage your human strengths and AI together, like moving forward?
Come with me if you want to live. No. Terminator reference. Thank you. Okay. I know, I said I wasn't going to do that, and I did it, right, Pete? Yeah, I'm an idiot, though. All right. I think I heard exactly what, and I love that you went rehumanize as opposed to like we were dehumanized. So like, let's rehumanize it. I thought when did we get cut out of the picture? I heard altruism. That's what I heard. That's not replaceable. That's a human element. I heard interdependence, and I love that. As a person who struggled with addiction, I became dependent on a substance, right? Dependent on the guy holding it. Then, of course, there's independent. I don't need you. I don't need any help. And then, of course, there's codependent. We've all been in that relationship. So interdependence is so important. I just wanted to cover that. If I'm accountable, responsible, and dependable, and you're accountable, responsible, dependable, win-win. Everybody wins, right? So we have to be that when dealing with such a powerful tool. We have to be accountable. We have to be responsible. We have to be dependable, because if we just go, I don't know, good luck, it could. We will need to rehumanize. And then, of course, the one thing I heard was the element of caring. And if we make a mistake, people die. God, I'm so grateful for AI being that precise, and so we can sleep at night. That is one of the greatest things I think about it. It just makes me laugh because I'm still working on natural intelligence, much less artificial. I think I might be the only guy in the room who's never used AI. I'm that dinosaur. I'm over here with a pen, like taking notes, But I celebrate it. I celebrate it for that very reason, so that you guys can be here tonight with your presence, with your powerful physiological message, and don't have to lose any sleep tonight. That's beautiful, right? I'm glad that the living space is just as beautiful as the dead space now. That one hit me. So there's a dead space, I think, somewhere in society. So for us to plant trees that we don't ever plan on sitting in its shade, that's the thing that we need in the human element. Thanks.
One thing I think that's really important is, so I'm listening to all of our these stories, and I'm intrigued by a story, many of the stories that we've heard, and lawsuits that have been brought recently against AI companies, of effectively the addictions that have been created, the psychoses that have been created. And it's interesting because it's true, right? There's a level of trust that you can't get over Zoom, for example, right? Like seeing someone in person and looking them in the eye, you can create a level of trust with someone that you just can't through any sort of medium. And yet we have so many of peers of ours who have come to trust AI far more than they should. And we talk about this with whether it's law or medicine or anything else, because an AI can give you lots of answers, but it's not accountable in any way, right? If you have a lawyer that makes a mistake, you know who to call, or the doctor or anyone else, but the AI isn't. It's just a lawyer. Yeah, you call the lawyer. In all of these cases, you call the lawyer, yes. But not when it's the AI, right? And so I think that I don't know how you do this, because software isn't my thing, but it's almost like an imperative that we build that guardrail in. I think one of the worst things that's been done is this the sycophantic nature of the chatbots that people are using, but the fact that they're designed, like, we should understand them as tools and separate from human beings, and that they can be tools, but I feel like there's an active effort to design them to trick the human into thinking they're a human and not a tool. And I think that's really dangerous, because some number of us will be tricked, right? Some number of us will think that the drug is love or whatever else, right? Some number of us will be tricked. And we don't know what that number is, but I almost wish that it's less what can we do and how do we separate it as a tool, but how do we put these guardrails on it so that it is always clear that it's a tool and not a human.
Thank you. Right. I got to bring it back to the doctor-patient relationship. That is sacrosanct. It'll never be violated. I think, as we kind of embed AI into our workflows, will I trust a physician who does not have AI sitting next to them? Hell no. Medical knowledge doubles every 12 days. How do you stay current? You absolutely cannot in this day and age. The volume of knowledge and information coming at you is just overwhelming. So when I'm looking for my physician, when I'm looking at my providers, one, I want them looking at me and not at the machine. And two, I want them to kind of engage with me, engage with the machine, and then come to a common diagnosis. Again, that's where we're heading. That's where we need to be heading. And we need to be present as a physician in that space. Don't remove us. Don't trust AI, and that without someone kind of steering it, because it goes awry very, very crazily. And every day, how many diagnoses do you hear? Your patients call you and say, what do you think? It's not a GBM. It's just, a meningioma. I'm like, you're a moron. Come on. So anyway, but to that end, don't trust it. Trust people who use it, specialists like Kavin who use it. So.
That's a good point.
Pretty much everyone answered that, but just want to go back to folks understanding that, when they get into the work sometimes, as far as social services or being a teacher, you study, you have, AI, I need you to Google this up for me, or whatever the language is. I'm new to the language, but I need you to give me this information. But then there's something with reality. It's good to have that info with the stats. Like if I was to say, tell me about West Kensington, and it could tell me all the crime, it could tell me everything that's going on. But then many times as a consultant too, outside of the Lighthouse, I would say, well, someone take a walk with me in the neighborhood. There's a whole nother level than reading up these stats. So for me, I need to stay connected and remind myself all the time. So now that the weather's breaking, I can get back to my usual routine. I would usually every week, I walk 3 blocks. I park up in the neighborhood and I pick a direction. I need to hear the gunshots like everybody else and feel fear. I need to smell the drugs in the neighborhood like everyone else. I need to see the commotion that's going on, or step over the human feces or the needles like everyone else, because I need to understand what it feels like to be down there. How can I represent a people if I don't feel it? So sometimes in this work, let's put even AI to the side. This work could allow me to stop feeling, because I'm caught up in the work and not knowing what people feel like. So the tools are there to get a better understanding, the stats, but it give you an understanding but not a feeling. And you need a feeling for that. And something I just left out, because it mentioned horses earlier. We have animals on the Lighthouse field. We have horses. There's something about horses when I'm having a bad time or a bad day, when I walk by, they will put their mouth on top of your shoulder, and it's like they know for some reason the energy you bring. And there's certain things that just AI just cannot capture. It could tell me everything about the horse, but it cannot tell me why is that horse connecting to me.
Thank you all. I think that gives you guys a really unique perspective that I think the world going forward is going to be humans augmented with AI. And that is the world. And I think if we use that appropriately, I think we will be better, but be actually leverage technology to be more human. And that should be the mantra going forward. And you know, when I was on a podcast recently and they were asking me all these questions about physicians and AI and everything like that. And the first thing I said is that you got to realize that we're so enamored by this technology, but this is the creator that created that technology, right? Shouldn't we be empowering the creator and not just the created, you know? And so I think that you have to think the same way. It is your brain and that capacity that created this technology. I think you got to empower both going forward. So that's the message. Hope you all have a great season ahead, but let's make 2026 a year where we empower both technology and humanity at the same time.